Mr. Chairman, thank you for holding this hearing. As you know, the Aberdeen area serves tribal members in both North and South Dakota, and I believe this is a very important hearing. For many years, there have been questions surrounding the agencies that serve Indian country. I consistently hear a variety of concerns from many of my individual Indian constituents. It is my hope that this hearing can provide the necessary insight into these problems and focus on solutions. I would like to commend many of those who work in Indian Health Service. I'm certain it is a goal to provide a high quality of care to our tribal members. While this hearing is to look at deficiencies at the IHS in the Aberdeen area, it is critical to focus on moving forward and seeking positive solutions to solve these problems. We must do all that we can to uphold our treaty and trust responsibility to American Indians. I would like to thank the witnesses for being here today to provide important testimony, and I look forward to working together to improve the health care delivery to American Indians. Dr. Robideau, the review conducted by the IHS indicated a need to take immediate action to ensure preservation of CMS accreditation. What are these specific action items?
Well, the one thing we're proud of in Indian country is that 100% of our facilities are accredited, and we want to do everything we can to make sure that that continues. What we do is we have an internal process of technical assistance and ongoing survey preparedness to help our sites, and then when there are either surprise surveys or regular surveys that have findings, we have a team go and help the facility to correct some of those so that they can have a corrective action plan to avoid losing their accreditation. So far, we've not lost accreditation, and we are very serious and very aggressively look into these recommendations that happen as a result of some of the surveys and unplanned visits. We're very committed to providing good quality of care, and the 100% accreditation that we've been able to maintain is very important to us.
Ms. Red Thunder, it is my understanding that only the hospital in Rosebud has a policy on diversion in healthcare services. Are you familiar with the policy, and can you explain some more about it?
Yes. Most recently, it came to my attention that Rosebud was the only hospital that had a policy on diversion, but that is being shared with the other facilities in the Aberdeen area, so we do have a policy.
What are the greatest challenges that contribute to diversion of healthcare services?
Staffing is our major issue. I believe we want to provide safe patient care, and if there's not nursing staff or providers, then we don't admit. We never close our ERs. It's our inpatient. We don't take any admissions, but we refer to a higher level of care.
Mr. Roy, based upon your review of IHS, what recommendations could you make about how to prevent and detect drug diversion?
Well, we have made several recommendations to IHS, specifically security measures. We're talking about changing locks on doors when staff change, when there's staff turnover. We've also recommended the two-person inventory counts. With respect to drug diversion, IHS has done a pretty good job of controlling Schedule II narcotics, the OxyContins and oxycodones. But we still see an issue with respect to Schedule III drugs and non-scheduled drugs because they're used on the street. They have a street value as well, and they're an addictive drug as well. I would recommend, again, tighter security measures. For instance, in one of our management implication reports, we recommended cameras in a certain facility. We also recommended, again, this two-person count. And although we have seen the two-person count take place. We have yet to see cameras installed in that particular facility. I would hope to see those recommendations acted upon to better secure and help deter drug diversion.
Is there any way of knowing the follow-up on your recommendations?
Well, when we submit a management implication report to an operating division of our department, we have an expectation that we receive a response in writing. And I would like to see better control of that. With respect to my special agents in the field, they are often at these facilities, and there is eyes on where they certainly will notice if certain parameters, certain recommendations have taken place. And I think overall, my special agents have a good rapport. They work well on in Indian country on these reservations and have a rapport with managers. And that facilitates this communication process and also ability to check and see if our recommendations have been implemented.
Director Robideau, what factors account for Aberdeen area's success at obligating ARIA funding, the stimulus funding?
Well, I'm really proud of the Aberdeen area for leading the other areas in obligating the ARA funding. I think that this is an incredible accomplishment. It's been very important for us to make sure that we get this funding out so that it can benefit the programs that will be benefiting from equipment or sanitation or maintenance and improvement. And I know that they have worked very hard and have worked very hard with the business functions that are necessary to get that money obligated. This has been a big priority of mine. All of the area directors have this in their performance plans, that they had to obligate 100% of those funds by the end of the fiscal year in order to receive a good evaluation, and this has been a priority of ours.
Ms. Red Thunder, how have you been able to increase third-party collection during your service as director?
At some of our locations, there's inadequate staffing, and so we've actually procured an area-wide contractor to assist. Through that contractor, they do coding and billing, back billing, and we've also had been successful with the state of South Dakota and the state of North Dakota to negotiate multiple encounter rates, and so that has helped in increasing our collections.